all of the residents have to do an ED rotation as a mandatory rotation. That only started about 9 or 10 years ago. Typically they would do internal medicine electives, they might do cardiology, but as emergency medicine as a specialty grew, so did the popularity with residents, and it was felt that it was more necessary. So when they do their rotation, they're really expected to see all types of patients. They see critical patients, they also see lower acuity patients. There are several different areas in the emergency department, one being express care, which is a lower level of acuity. Things like minor orthopedic injuries, cuts, bruises, colds, and they can do part of their rotation there, but they're also required to see more critical patients as part of their rotation, such as patients with life-threatening heart conditions, life-threatening lung conditions, life-threatening abdominal conditions. So they're really required to see the full breadth of patient pathology. What we ask them to do is to see patients in the order they come in. It's very tempting when you're a physician in training to sift through the charts or to sort of pick among the patients you feel the most comfortable with. So what we really try to enforce in them is that the most important thing they can do, especially at an early level of their training, is to familiarize themselves with patients they might not be so comfortable with. So we ask them to see the next chart. We do, since they're only in their first year, we ask that if they identify what they consider to be a truly emergent condition, then they need to involve the attending that's supervising them immediately. Any gunshot wound, with the exception of a gunshot wound to a distal extremity, would be considered very critical, and if the residents were dealing with that, they would have to have the attendings involved immediately. Although, once we're involved, we do attempt to have them manage the case. Or the typical way that we would do it is to have them decide what they would do, and then we can give them feedback on whether or not we think that that's correct or not. But they need to learn to make those decisions.